Assalamu alaikum, the communication day. You are the doctor in the medical clinic, Mr. Harry Wibberley, aged 62 years, regularly attends clinic for his severe asthma. He has been on high-dose corticosteroid, long-acting beta-agonist inhaler, and anti-leukotriene medication for many years. He is well known to have multiple allergies to common allergens such as house dust mite and cat dander and pollen. He is regularly on steroid, and as a result of long-term usage, he has become paranoid. He is desperate to try anything. He's seeing you in the clinic today, and he tells you that he saw an advertisement on the internet regarding a new portable breathing device which claims to cure asthma and which has been ordered for California for $65. He seems convinced that this device will cure all his asthma problem. Please sit with him, discuss the pros and cons of this internet information technology, and discuss the other possible cure for this new device. I will share the timer, then you can start, Dr. Sar.
Okay.
I remind you while 2 minutes left.
Okay.
Yeah. Okay, here you go.
Okay, hello, I am Dr. Ghanem, Dr. in clinic. Today, may I confirm you are Mr. Harry Wipperly, 62 years old?
Yes, Doctor, I am.
Okay, hello, Mr. Harry. I'm here to discuss issues related to your health condition. Is it okay with you?
Yes, Doctor, okay.
Okay. To be in the same page, can you please tell me what's the problem?
Yes, Doctor, I'm suffering from asthma for many years. I take many medications, inhaler and tablets, but my asthma uh, still present and still suffering from it. Recently, I saw a device on the internet. It claims that it help in asthma and it treat asthma, and an order it already from California. It is $65, Doctor. And I need your honest opinion about this device.
Okay, Mr. Harry. So what are your expectation about this?
I expect it is great, Doctor. It has helped many people. So, and I saw reviews on it. It is a great device.
Okay. First of all, about your asthma. You told me it is not controlled, right?
Yes,
So you are taking your medication regularly,
yes, Doctor. I take it regularly.
and you take all medication.
I take inhaler and take steroid medications.
Yes, you took all of them, right?
Yes.
You know the good technique for inhaler.
Yes, my doctor teach me.
Yes. So you know how to take it, and you take it all, and you are compliant with it.
Yes, yes,
Okay.
doctor.
You are aware about the triggers of asthma.
Yes, doctor. I know the dust. I don't have pets in my house. Um, uh, the, I try to avoid the triggers as much I can.
Okay. So okay, that's good. So you know how asthma develop, or how person get asthma?
No, I don't know, doctor.
Okay, it is like an inflammation or soreness in the airway, and this inflammation with time cause narrowing to the airway, and this cause the difficulty in breathing. You are aware about it?
Yes, doctor. I know there's problem in my airway. It's tight
Okay.
and can't take my breath.
Okay, that's good that you are aware of the asthma, how it develop and how it cause complication to the patient. Okay, this device that you bought from California on the internet, um, I think this device is not known and not approved, and doctor didn't advice with it, right?
I don't know. I don't know if doctor advice. So I come today to ask you, doctor.
You already bought this device, right?
I ordered it, but it is not rich.
Okay, so we will see this device and we will try it. We will discuss this, but I don't know about its efficacy. I don't know about is it effective in preventing asthma symptom or no. Okay, so we will try it and we will see if it is effective for you or no. But meanwhile, in this situation, you need to take your medication and to avoid triggers and follow uh, the precaution and the steps of asthma treatment. Okay.
Yeah. Hmm.
Okay. So I need to know what do you do for a living?
Uh, I am retired, doctor.
Okay. So do you smoke?
No, doctor, never.
Do you drink alcohol?
No.
Okay. Okay. So what we need to do now is to follow the steps of asthma treatment is to take our medication and take know the how to use the inhaler and to check this and also to be away from infection and treat it properly because it can aggravate asthma. Okay.
But I want to know about this device, especially. I know about medication. I take it many years, but it not help me. I want to know about this device and why, if it's not good, why they make this advertisement.
Okay. Advertisement on social media could aggravate the bruise of or the effectiveness of the devices they are selling. But maybe in fact maybe it is not like this. So I advise you if you get this device to get it here to the department and we will see if it is effective for you or no.
Okay, doctor. Yeah, now you allow me to use this device.
Before we need to check it before use.
Okay, doctor.
Okay, so we need to try it and check it before use and to address its pros and cons or the good effect and bad effect of it.
Okay, doctor.
Because sometimes they can say that it is effective but may be effective to some people and not effective to others, may have side effects and they are not telling about it.
Yes, doctor, you are right.
Okay, so before trying to use this device, bring it to the department and we will check it and check its efficacy on you. Okay.
Okay.
Okay. You know I can understand how you suffer from the medication and the multiple medication you take. But this condition, which is asthma, is a long-lasting disease, and it is not like curable one. It we learn to live with it. Are you with me?
Yes, doctor.
Okay. So about medication, we will try to help you with the medication. Um, we will try to decrease the side effects or deal with the side effects and monitor you and do the test, the blowing test for you to be sure about your symptoms and your the asthma activity. Okay.
Yes, okay.
Okay. So you have any other concern?
No, doctor, only about this device. I hope it will work well.
I also hope it can help, but we need to try it first and check it first before you start to use it.
you, Dr. Say.
Okay.
2 minutes
So,
left.
okay. So you have any other concern?
Uh, no, doctor, no, I don't have any concept.
Okay. So you need any kind of support
No, about what?
in your daily life? Um,
No, only support. I need proper treatment for my asthma.
Okay, be sure that we are giving you the proper treatment, and it is as we discussed, it is like a stepwise treatment, and um, we are trying to monitor you and doing the test, the prong test for you in each visit, and I need you to be in contact with the asthma clinic, okay, and do the regular checkup for your
I do all
asthma.
of these steps. I do the long test. It's never above 150 meter. I also avoid every triggers of asthma, so that I searched about something else to help.
Okay, I can understand your feeling and how difficult these symptoms for you. Be sure that we will try to help you in the clinic, and we will check this device and to see if it is suitable for you or not.
Yeah, doctor, thank you.
Okay, thank you.
7 seconds. 4 seconds. 3, 2, 1. Okay,
She
time's up.
already know everything. She already know everything.
Yes.
I
Even
give
you can offer.
leaflets and brochures also.
Yes, yes,
You
again.
can suggest يعني, websites
Group, link
Social
group
group.
for asthma
Social
patient.
group.
Yeah. Okay, let's hear the comment from Dr. Marwa, please.
uh, yeah, I think Dr. Sarah did well. But missed the point. She should talk about the advantages and disadvantages of the internet. She talked about the disadvantages and it's not helpful, or maybe uh, not working or cheating, but not talk about the benefit from internet and how can use it in proper way, as in
Correct.
the asthma societies and
Mm,
approved websites, and they take the general information, not the special information, general medical information.
okay.
Yes, you no no comment, no other comment.
Okay, the judgment, Dr. Marwa. So for started by clinical communication, the approach, the
Uh,
introduction, the explanation.
Satisfactory.
Okay,
I think also
and
according to me.
all.
Oh,
So okay, I agree. She did well, and the good thing, Dr. Sarah know how to fill the time with ideas. It's very good, Dr. Sarah. You have a lot of things you can talk about. You can suggest any issue. I mean, you can fill the time all the time in the exam, and you can convince the patient well. I agree for the full mark, but the point of triggers, you didn't address it well. He wrote or he said to you, and it was written in the scenario that he has allergy to a lot of things. I think also here you can add the point of desensitization if the patient still has allergy as a clinical judgment. I mean, you can refer him to the clinic of immunology to do the test of allergy. Or if he is already diagnosed with allergy, you can do the desensitization test or desensitization management. I don't know if it's written, Dr. Marwa, in the scenario or no.
no, not
It's not.
written.
Okay. Anyway, he is already allergic to most of things, and he has to avoid these things. Whatever, he should try his best to avoid it. I think Dr. Sarah also didn't push on this point. Are you agree,
Which
Dr.
point?
Mara?
Which point? Which point?
Avoiding the triggers.
لا, she
Yeah, she
asked
said it
about the
once. I
triggers
mean,
and
yeah, she asked
لا,
once, but she didn't say stay away, try to avoid them. It's
I told her I don't smoke, I don't have pets in my home.
but
I told her I
it was
avoid
written in the
triggers.
scenario. I don't know. There is debate.
Uh, but the patient avoid all triggers
Okay, so
and
he has
take maximum
allergy, but
medication.
he's not having them.
Mm.
Okay. Regarding to the job, is it hidden
Mhm.
agenda for previous job?
Not written any
That's
hint
it.
about our job.
Okay. So you deserve the full mark with no debates.
You're
Satisfactory
trying
all.
you're trying not to give me the full.
No, no. I try to give you some clues. It might help you in the exam. We are judging now based on a scenario, and Dr. Marwa, the one prepared the scenario. I added some suggestions, and if it can help. I mean, it's okay. But if not written, and
I
for
will
here you
send
are
the explanation. I will send the case, whole case
okay.
in
And the
the
machine, as Dr. Sarah said, we have to test it before using
Mm,
it. So please provide us this machine, and we will try to test it before you use it, and it might harm you instead of helping you to breathe. Okay. Any point regarding cushingoid features or cushingoid because she didn't mention it. Cushingoid.
mm.
Anything
In
written about
the special, no, nothing written, but
nothing. Okay.
they tell they write and tell him therefore that you doubt whether the device he has bought will be successful. Also, there is no harm in trying, يعني not prevent the trial.
So
Not
yeah, you will be neutral. Yes, you will not be
mm,
against or you will not be
has
with.
yes.
Okay.
I
Well
think
done.
like any new modality of treatment,
Yes.
we have to
Yes.
be neutral. Just try
Oh,
it.
oh, uh, also, also tell him that you have not seen any randomized controlled trial using this device in asthma, explaining to him what this means.
Yeah. It's similar to the scenario of using herbal for infection, and you will tell him it's not evidence based. So we have to do not to believe on that, and
Mm.
we are following the guidelines. As Dr. Sarah said, there is stepwise management for asthma, and we are following it. It's guidelines in the whole hospital over the world, and we are trying to apply it step by step until we control your asthma. There is
Yes,
campaign called asthma campaign.
I
Yes, Dr. Mahmoud.
I have comment, Dr. Basim. In the real exams,
Yeah.
there will be a hidden agenda. Patient not improved despite optimal treatment. So sure that is the trigger. In the exam of in the case of exams of bronchial asthma, there is hidden trigger. Maybe bits, maybe his job, maybe
Yeah, I
patient.
remember fireman
Yes,
scenario.
yes, a fireman.
Mhm.
So in the exams, always there is a trigger. So the patient why not improved despite he
Oh,
is on maximum
the
treatment.
doctor, the issue in this scenario, the internet, the
Yes,
use of internet.
it is also a good point.
Mm,
Like these scenarios, I think I listened to my friend told me about this. They told the surrogate, okay, I will take from you the links of this website and I will read it more and show يعني show if it is benefit or not. So I think
Yes.
I think I think I think just talking about that it is just advertisement or everything in the internet. I think it is not good option.
No, as Dr. Sarah did, you have to be neutral and diplomatic.
Yes,
We
neutral.
are not,
Yes,
yeah, we are not encouraging and we're not discouraging. Let's see the machine, let's try it, and we test it before we give it to you. Don't
yes,
use it by
doctor.
yourself. Yes, you have to say that. You don't use
Mm.
it by yourself, and unless it was prescribed by your doctor or it was tested by your chest doctor. If it will help you, definitely we'll give it to you. That's it. I think this is the hidden agenda. Yes, it's okay to use, but we have to try it. Okay. Any other comment? Again, the way how she's using the technique of the inhalers, the way she is taking the medication, the compliance, all these things will help, and you should ask about them, and especially in asthma patient. It's not history taking. You can ask all this because it's related to the scenario and to the deterioration of her condition. Okay. Anyone else want to comment? Anyone want to deduct mark from Dr. Sarah other than me? You deserve, Dr. Sarah. We are trying to be hard with you in
Okay,
order
okay,
to get the full mark.
okay,
Okay,
I
but you
understand.
did well. Really, you fill the criteria. You fill the time talking, and you didn't. Only the last second, even she knows. Okay, provide her some social groups, as I told you, leaflet brochure, and also you can give us the link for the machine, as Dr. Mahmoud offer also to read about it. Now she's
Sure.
the one will offer us. Let's see the machine or the link for the machine, and we will update you whenever it's approved by our doctor or no. Okay.
Oh, okay.
If fireman in the scenario, if the fireman job in the scenario, what you will do, Dr. Sir? Because this is always coming.
Yes, okay. We will try to reallocate him because this could worsen
Mhm.
his condition so much.
Yeah, doctor,
And
but it's my dream to work in a fireman position.
okay, I can understand. Yes, but if we do cost benefit effect, that will affect your life, your quality of life. That could
Risk benefit, you mean? Risk benefit,
risk
yes.
benefit, yes,
Uh-huh,
risk
okay.
benefit that could affect you so much and affect your quality of life and cause you exacerbation or increase attacks of asthma, and this can affect you. You will not be happy in your life with this symptom coming and going
No,
all the
I,
Yeah,
time.
I, I want to be happy helping people, doctor.
yes, he will refuse.
Okay, that's very good. You want to help people. There is many other ways you can help people,
Okay.
right? Not like this, not only like this. You can help people in many other ways without hurting yourself.
Yes. So you can tell even while you are helping your colleagues, again, you are helping the people, even in the office job. It's a good idea to say that. And
Oh
at the
yes.
end, yes, if still
Mm.
insisting, what you will do?
Um, Please try again because this affecting you. Try again. Think of it many times because you have family, you have loved
Yeah,
ones. They
perfect.
need you.
Yeah. You are precious to us as well as for your family, and they
Think
love
again.
you.
Please think again. It
Yeah.
is not like your life alone. You live with people. They love you and they need you.
Yes, exactly. Okay, at the end, still insisting. No,
May I
doctor, I want
involve
to.
my consultant? May
Perfect.
he can convince you. Um, and if you need any help, we are with you. We are here for you.
Yes. Yeah, so he has the way, a good way to convince you. He is professional than me to convince you.
Mm.
Yes, I think.
Professional.
Okay,
Occupational
Sorry?
there is a good
Uh-huh.
idea, Dr. Bassem.
Yeah,
Yes, a good idea for this scenario. At the end, he will refuse. The fireman will refuse. She will tell you it's my job, it's my money. How I can know? Even the
mhm.
consultant will refuse. I will refuse. So we can tell him we can try another option, but can't be benefit for you or not. That we wear there is a mask. There is a special mask you can wear during your job. So we can try this way if it is benefit to you or not. but if not benefit for you, you have to relocate to into another job.
Reallocate.
Yes,
Yeah, reallocate.
relocate to another job. So we can try first a special mask for you in your job.
I am not sure about this mask. Maybe he will
Yes.
go and he will die on on
No,
theater.
it is a special mask
Okay.
can protect him from smoke.
Okay. So if you are sure about this information, you can suggest it.
Sure.
Okay. Thank you, Dr. Mahmoud. Any comment from others? Dr. Elvarvio, your consultant? Yes, exactly. Dr. Marwa, you want to add anything? You want to ask?
No, as a occupational team in this scenario, in the scenario of firemen,
Yes, the
can help
Yes.
occupational health worker will provide him with a special mask. Yes,
Mm.
that is the answer.
But again, any risk might
If I don't
harm.
know about this this mask, I think I will not go with this. I will ask him to do another job. I think
Yeah.
this is the right thing
Not
for
other job.
my
It's
opinion.
another position.
Okay, another
No, it's,
away from field
yes,
field
yes,
job.
exactly. Away from the fire, so you can work in the either on the car, maybe on the office job, whatever. But away from the fire. I agree for this, but I think it's individual. If you want to say it, Dr. Sarah, it's okay. If you don't, it's not harming the mark, I think, because always we are seeking the sake for the patient. Okay.
You can say
I
protective measures, not name mask. Protective measures.
I don't think even the smoke from far away, if he smell it, he can be injured. I think so. You got it. That's why
I
the
think
fireman always wearing the clothes, preparing themselves before even reaching the area of the fire. But the smoke itself might stay. If the effect might stay a long time, and even the smoke itself might harm him. It's not the only fire, the smoke even. This is my opinion. I'm not sure also, but it's okay if you can do it. But for me, I can follow the reallocation only. Okay. Any other comments?
Yes, Dr. Basim. I think there is no right, no wrong. Um, if you are not confident to say mask, it's up to you. Occupational worker will reallocate you in the same organization in different place, and just inform us the patient safety is a priority,
Mm-hmm.
and do we need to save you for your family. Yeah, there is no model answer for this
Yes.
exam. So
Yes.
it's very subjective. It
Mm-hmm.
depends on the experience of the candidate, experience of the examiner as well. I don't think there's a general agreement in some options,
Of course, I agree with you.
but there is no right, no wrong.
Yes.
I
No.
mean,
Yeah.
I'm not aware about the mask. If someone uses the mask, can say it.
It's not 100% yes protector.
Even the
It's it.
machine, there's no machine to cure asthma.
Mm-hmm.
This is fake. I have never seen. So Ahmed, if the patient refuse to change his job, you will let him. Actually, I will inform the patient that you have to inform your employer. You have to. You must inform your
Yes,
employer by law, because you
no,
sign. No, because he signed health declaration form
Declaration. Yeah.
before
mm,
joining of the job. So if he's asthmatic, he's not fit for work. And by law in UK, he should inform the employer.
But Dr. Mahanna, Dr. Ahmed, don't use it by confrontation. Don't say by
No,
law.
no, no, no. I,
Yeah,
I,
it's
I will say you have to inform the employer
no, no.
because
Don't say also you have to tell him better to
it's
review your
not
company.
this is rule. Like he has to.
Yes, he has, but you haven't the way to say that. It's not the way by confronting. You have to.
No, this is not
You should do.
confrontation. You should be very sharp in lawful things. If it's, if there's any conflict with law,
you will be very clear. Yeah, yeah. You sign. Have you signed the health declaration form before joining this job? He will say yes. So by law, you are obliged to inform your employer. You can say like this.
I agree about the idea, but how to deliver it? This is the way how to put
Yes.
the to get the full mark. If
I
you
think.
said,
I
yeah,
think.
better too.
Don't be over soft.
No, 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 no. You have to be over soft with the examiners. They are judging in on every
No,
single
no.
thing.
This is the welfare and the communication. If you fail to deliver the message to the patient or you give him confusion, this is a point. This is communication problem. So the patient should leave this meeting aware that he has to do by any way deliver your message by any way. I mean, don't say you are stupid. You should do. No, no. You will say, have you signed? You can get it like this. Have you signed joint declaration form before joining this job? He will say yes. So I'm sorry to say, by law you should or have to inform the employer. I'm afraid to say that, but this
Okay,
is the law. Yeah,
let's repeat it by another way. You sign a declaration form in your job. Yes, doctor. So it's better to inform your employer or the manager to protect you from this in order to be safe. You can reallocate he can reallocate you in another job or in another position away from this fire. It's okay to be only calm and to be polite with him. The way you can confront him or you would confront him, it will minus your mark. Definitely. This is my opinion. So you can convince by either by this way as sharp or by law and whatever, and you can convince him by soft way, but you will get the mark with the soft way not as the other one. This is my opinion again. So
We
it's
need the
okay.
mark. We need the mark, Ahmed, not we.
Yes,
Not
we need the mark. We don't need the
yes,
patient safety. We need the mark.
yes. I need the mark.
Okay, so it's okay. Yes, you can use it as a weapon, but use it with good way. Okay, this is my always advice. Don't confront. Don't force. Even you are talking gently with force way, it will give you minus. I'm sure from this. But if you talk gently with a good way, convincing the
but
patient
if the
or
patient
trying
is
to
not
approach,
allowed to do something, he's
he
not
has the
allowed
right
to
to.
refuse.
No
He
problem.
if
No
he will
problem.
be, yeah,
Okay, what we will reach with him? The
nothing.
last step.
No, no.
Nothing. No, we will meet him with the consultant. We will
Yeah,
arrange a
yeah,
meeting with the consultant.
yeah.
Okay, maybe this is the aim of the meeting. Maybe the instruction for this scenario, don't agree unless he will inform you about a meeting with consultant. Maybe this
Yeah.
is the
It
aim
could
of
be.
the scenario.
Mm,
You got it?
yeah.
So you might reach to this level, and he will be convinced with this. But if you keep insisting by fighting or by confronting, you will not reach to the meeting and you will be failed the situation. This is my opinion again. But please try to be gentle, as Dr. Mahmoud said. We want the marks, we don't want anything else. So show the examiner that you are calm, you control your temper, you are trying to convince the patient by a good way without harming the feelings and behavior. That's it. Okay. Dr. Sarah, you prepare the scenario for Dr. Marwa
Yes, on the group.
on the WhatsApp group.
Yes.
Okay. Any question regarding the previous scenario until Dr. Marwa prepare herself?
No, in this scenario, because I didn't attend it in the beginning, we'll
Yes.
tell him that there is no cure for asthma. We'll try to check for his using of inhaler, and
Mhm.
try to check for triggers in communication, or this is history taking.
No, 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 no. We have to.
Hmm,
We
okay,
have to do because this is the way how to approach why this patient is not controlled. You have
okay.
to know why, and according to that, you have to solve it. Let's say in this exam, in this scenario, the patient have a cat or has a cat, and
Mhm.
while talking with him, you ask this question, and he told you, yes, I have a pet. It's my wife cat or a pet or whatever. So now you know the solution. Please stay away or try to put it in a garden. Yeah, this is the way how to approach and how to address and how to solve it. Okay. And for Dr. Sarah, if the patient has a bird or has a cat, I guess I said it, so you have to know this.
Yes, yes. I asked it and she said that I am
No, no,
avoiding all the triggers.
no, no. If he has a cat, how you can solve the problem?
Take it to the pet house.
Yeah, or in the garden or outside the house
We
you
are
are
not
living
putting
in.
cat in the garden here.
Really?
Cat. Yes, there is
Maybe
no cat in the
maybe the
street.
patient will live in
Or
the garden.
dogs. No cats or dogs. Only fox.
Oh, so the patient will live outside the house and the cat will be inside
No, she can take it to the pet house, can give it
pet
to us
house. Okay.
for
You
us.
should
It's
So
get
tell
rid
us
of it.
about the
Get
ideas,
rid of
Dr.
it.
Sar.
so for
So
this
take
scenario,
the
this patient,
yeah.
we told him this is device is not true, or what? Or
No,
how
no,
you
no,
should.
no, no. Don't say it's not true. It's not advisable. It's something we don't know about. We are not. It's not according to the guidelines.
Hmm?
If you he will say I order it already. Okay, please bring it to us and we will test it before using. If
Hmm.
it's helpful, so we can use it.
Okay.
Okay. Okay. Let's read the scenario. Second scenario: patient was admitted 2 days ago. I think the name was in the group.
Lisa,
Mrs.
32
Lisa,
years old.
yeah, 32
30.
years,
Hmm.
was admitted 2 days ago with severe left loin pain and tenderness, vomiting, fever, dysuria, and urinary frequency. She has had several previous urinary tract infection. A diagnosis of acute pyelonephritis has been made. The intravenous antibiotics already prescribed. The patient was also prescribed intravenous fluid and analgesia. The nurses have asked you to see the patient because she is upset and insisting on discharging herself from the hospital. The ward sister doesn't feel the patient is well enough to go home. She's due to have an ultrasound scan of renal tract later today, which had to be rebooked from yesterday when the test was cancelled because the patient didn't have a full bladder. So you are sitting with Mrs. Lisa, 32
Yeah.
years, Dr. Maro.
Okay. Start?
You ready?
Yes.
Okay. I'll reset the
Mhm.
timer. Yeah, here you go.
Good morning.
Hello.
My name is Dr. Marwa, one of the doctors in the ward today. Are you Mrs. Lisa, 32 years old?
Yes, doctor. Yes, doctor.
Um, how are you, Mrs. Lisa? Are you fine today?
No, doctor, I'm not fine.
Why, Mrs. Lisa? Why?
I need to go home, doctor. I'm not fine here.
Okay, I'm here today to discuss this issue with you. Is it okay with for you?
Okay, doctor.
Before we start, I want you to tell me about your condition and what you know about it.
Okay, I'm here since 2 days. And I am here because I have this pain in my back and also the difficulty in water work. Um, and this symptoms, and they told me that I have infection in the water work, and they started me medication, but I am not comfortable here. I need to go home.
I'm sorry for your suffering, Mrs. Lisa. Uh, do you have pain now? Do you have any
Yes,
pain now?
I am in pain and I am not comfortable.
Do you need any painkiller?
They gave me the nurses gave me.
Okay. Uh, as you said, you have bug infection in your water work, so you admitted in the ward, and we giving you your antibiotic. antibiotics and antibug medications to solve this bug infection. Why you want to leave the hospital?
Okay, doctor, it's my first time to be in a hospital, and they put me in the ward with this noisy, confused patient. So I cannot tolerate this.
Sorry for that, Mrs. Lisa, but we can manage this. We can transfer you to a quiet room and decrease any noise around you.
Okay, another thing, doctor.
Mm.
Yesterday my scanning was cancelled because they needed to have full bladder, but I just been to the toilet and no one told me that, and I think the technician was blaming me.
No, Mrs. Lisa, no one blaming you. We are here we all here to help you and make you comfortable and make you uh, healthy and treating you. Uh, yes, you were scheduled to do the scanning for your water work system and your water bag. But this scanning needs your water bag to be full with water before doing it. So you should preparing for it by drinking a lot of water. For
Now I'm waiting for this scan and I'm desperate to go to the toilet, and they are making me late. So I
uh,
need to go home. I need to go home. That will be very good for me.
Sorry, Mrs. Lisa, for your suffering in the hospital. We will discuss this with the radiology department and make uh, your scan as soon as possible. We
When,
will.
doctor? When?
Uh, I will call them and arrange and make your turn within hour, within 1 hour, or as soon as possible.
Okay, still I need to go home. I'm not well here.
Can you would explain to me the reason?
It will be easy for me if I am at home. I can take medication at home. Why I should stay here?
Because your bug infection need to be treated by strong medications that take by um, injection in your blood channels, uh, and your condition should be monitored and observed by scanning and blood test. So you should be under medical observation. Miss Lisa, are you with me?
Yes, I'm with you, doctor.
Uh, we do our best to help you and make your stay in hospital comfortable to you. And uh, we are here to listen from you, your complaint and what you want to be comfortable. You can say what you want.
So what you are going to do for me now? Now, what is the
Now,
plan?
now we will uh, arrange. We will see if we can transfer you to more quiet room, and we'll contact with radiology department to do the scan for you as soon as possible. Is it okay with you, Mrs. Lisa?
If you do this now, I can think again.
Good, Mrs. Lisa. We will make this. Uh, we will yeah make this as soon as we can. Have you any concern, Mrs. Lisa?
For now, no.
Okay. Do you still want to leave the hospital?
If you start the arrangement, I will stay.
Okay. Your stay in hospital better for you. As I told you, your condition need close observation and treat specific medications. So staying in hospital can allow can make you take the proper medication in proper way and proper timing also. But can I ask you with who you live in the house? In home?
With my partner. My partner.
Okay. What you do for living?
Okay, I'm a teacher.
Okay. Are you smoke?
No, I don't
Do you
smoke.
smoke? Do you drink alcohol?
Socially.
Okay. Do do
2 minutes
you
left.
do you drive?
Yes, doctor.
Uh, i- is your this pain affecting your drive?
No, just 2 days.
Do you need are you financially support?
Yes, doctor. I'm okay.
Uh, 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 do you have any concern?
No, doctor, thank you.
Okay, I will give you some uh, brochures about your condition, explaining the symptoms and signs and the ways to treat it. Okay, okay for you.
Okay. Okay.
Thanks, Mrs. Lisa.
Okay,
Thank you.
still 45 seconds. What you want to do? Mm.
Um,
You can recap?
do you,
Yes, yes, at least, yeah.
okay, I didn't hear this here.
Recap. Ask her what did you
Uh,
get from
uh,
our meeting?
what, can you tell me what you get from our meeting today?
Yes, doctor, you told me that I have this waterwork infection and I need to stay at hospital, but under the condition that we agreed to, that you will move me to a calm room and giving me the test now.
Perfect. Time is
Okay.
up. Yeah.
Okay.
Well done, Dr. Marwa, really. Let's um, let's hear the comment from Dr. Sarah.
Okay. Yes, Dr. Marwa. I'm sorry because I was angry. Okay.
Oh,
But this is the scenario. Okay. First you need to tell her that your condition uh, is very severe and you cannot go home now because you need to take this fluid and IV antibiotic. Okay, and allow the patient to describe her feelings that she is angry because of a lot of things, and she told, and you can address everyone and find solution like moving her to a calm room and calling the radiologist now at once to do the test. Okay, and we that you are here to help her and you are appreciating her feeling, okay, and apologize for delaying this scan, and also that the nurse didn't tell her about that she need the bladder to be full to do the scan, okay. And after that you can acknowledge the patient autonomy that she can move and leave the hospital if she want against medical advice, but it is better for her to stay at hospital because she still need uh, medication, and this will be difficult to have this at home, and also need monitoring. Okay. If she insists to go home. You have to tell her that if you have any alarming sign that severe pain or become feverish or any abnormality, you need to come to the hospital again. Okay, but you did well and addressed all the concerns. Um, okay, um, okay.
For the marking,
Before
I cannot give marking.
why?
I cannot give marking, guys. Sorry.
Okay, I will judge on her performance. Any question, Dr. Marwa, before I will start?
before starting the discussion, I was planning to make assessment for her mental capacity.
Mental
I
health
think
act. Mhm.
I think she is confused or something like this. But her
You can
performance.
ask her one question
Mm,
in the beginning.
mm,
But you started well, Dr. Marwa. You ask her, how do you feel now? Are you okay?
mm,
Really, you were very calm. Like you drink some lemon juice before start the scenario. I don't know how you manage this anger from Dr. Sarah, but it's very nice way to address all her concern. She was angry, shouting, but you were very calm. You didn't even shout or raise your sound, which is very good. Okay, I advise to do this because in the exam and good surrogate, Dr. Sarah today, she was very good surrogate because in the exam you will face such kind of surrogates. They are shouting and she will irritate you or he will irritate you. And if you wouldn't control your temper, you might fail the station. But you did it well. The introduction was good. The question at the beginning, are you okay? How do you feel? Yeah, and she told you, no, I am not feeling well. You ask her immediately why. It's a good question because you, from the first sentence, you got one concern, which is I feel discomfort because of the
mm,
noisy word or noisy surrounding with the confused patient. I'm not like them, okay? And you address it immediately. We will put you in a quiet room or in a quiet ward or whatever. But you did it well in this point, I mean. This is the first concern, and it was great to address. The second, I want to go home. You ask again why you want. I go take the medication at home? No, it's better to be here for your sake and the best interest for you to take this medication at the hospital because it's through the blood channel. And the good thing also, Dr. Marwa, you didn't have jargon, only radiology. When you said radiology, but
mm.
the other scenario, you did it without jargon. Uh, but
So how
I
can
wanted from you
say radiology? How can
a
say
scan doctor,
radiology?
a
Scan.
scan doctor, or a scan department, or yeah, okay, or image doctor. Scan or image,
Mm,
it's both equal. Uh, when she told you that the technician blamed me why it's not full bladder and so, you have to be sorry for once, as Dr. Sarah said, once
mm,
only. I'm so sorry for that, and it's for misunderstanding, and for this behavior or whatever. So be sorry for once, just to relieve her temper, because again
mm,
she's angry because of this behavior. Apart from this, yes, you have to say, or you can say, we will arrange a meeting or sorry, appointment as soon as possible. If she insists for now, tell her I don't know the situation. Yes, I will try my
mm,
best to be as soon as possible, but it's difficult to say now. And if you didn't do what she wants,
No, at
like
least call them now. Call them now.
yes,
I will
okay,
call them.
the
mm,
calling, okay, but the appointment
Oh,
maybe,
yes.
yeah,
You
as
take an
soon as
action
possible.
now.
Yes,
Yes,
yes, I
but you take an
agree.
action now.
Yes, okay. So we can arrange it as soon as possible and we can call them now. Okay, no problem for calling them. But for the appointment, I am not sure when you can move. However, we will arrange it to be as soon as possible. Don't say 1 hour or 1 minute or five because she will count on you. Doctor, five
mm.
minutes left. Why you didn't move me? 1 hour now, and you said after 1 hour. So the best thing as soon as possible. It's equal no frame time. Whatever or whenever they are ready, we will move you. So for I will judge now for the clinical communication. I can give you satisfactory because you kept calm all through the scenario. For the clinical judgment, you address everything, even the medication. Yes, she should stay to take the medication at home. And if she insists to go home, what you will do? Dr. Sarah told you this. If
She
still,
will sign Lama, I think.
okay, before Dama.
Lama or Lama.
Hmm?
Yeah, Dama or Lama. Lama for what?
No, 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 Dama. Before the Dama option, what other option you can offer? Again, and as any scenario, you,
Consultant.
yes, I will
Arrange.
arrange a
Yeah.
consultant, a meeting with my consultant. He has a way, good way, professional way to convince you to stay. And
Mm,
if she insists after that, this is her right. And if she insists and the scenario is about to leave, yeah, I mean the patient already leaving, before
mm,
she leave, you have to give her some red flags. Okay, if you
mm,
reach to this moment, I mean, if you reach to this level of scenario, she's leaving and everything, okay, I'm feeling fine, doctor, don't give me anything else. I have to go home. I have some social issue. I have to go. And you reach to the level, yes, okay, if you want and insisting to go, you can sign a DAMA paper. What you will offer here, the red flag. Please,
mm,
if you feel flank pain or tummy pain or back pain, if you have change in the water work amount or color or frequency, or you see blood, anything abnormal, you feel unwell, don't hesitate to call. This is called follow up and follow up care. Okay, even she's leaving them against her against medical advice, and you advise her, but still she insists, but still you are keeping care about her. Okay,
mm,
so you can tell her some instruction, please, if you feel these things, or if you feel unwell, if you pass less water work or bloody or change in any nature, any stone, you feel back pain which is not tolerable, any abnormal feeling, please either call us or visit us immediately. Why you are saying that? Because she left already without finishing her treatment, for example,
mm,
and she might have relapse or recurrence of her symptom. So please give her some follow up or some instruction to come back. And again, also you can tell her the follow up will be arranged to come back if you have any inquiry. Okay, they like the follow up point, whatever the scenario.
But if she agreed to stay,
No, no, I
how?
mean, this is
Mm,
another scenario. The
mm,
scenario will be about patient leaving against medical advice. In this scenario, yes, she's convinced and she will stay. So it's good for her. Thank you
mm,
for staying with us. You will have a good time with us. You will not be discomfort again. We will do the image for you. We will try to finish the steps of your management plan as soon as possible in order to leave home on time. Okay. So again, in the clinical communication, satisfactory for the judgment, I can say also satisfactory, welfare also satisfactory, and as well as for the concern, you address all her concern. Driving issue, I like when you ask about driving by another way. You said the driving, but it wasn't a good question, right? I think it doesn't make sense to ask about driving with the renal issue,
mm,
but you correlate it with the complaint, any affection to your driving. So this is a good way if you ask driving in a scenario and you feel that driving is not making sense to ask about. Okay.
mm,
For example, patient has joint pain, a hand joint pain, and you ask, and you felt like the surrogate looking at you, what the relation between driving and my symptom. So you can't say again the question, does this symptom affecting your driving? Because you ask
mm,
about drive, is it something related to vision? Do you drive? Yes, I drive. What's the problem if I drive? So you can specify you have any affection to your driving by this symptom. The same of impact on your job. Okay.
mm.
So I guess you get the full mark, Dr. Marwa. Anyone has comment, please. He can comment or he can judge on Dr. Marwa performance. Dr. Mahmoud, you want to add anything?
No, no, Dr. Basim, but the only thing is that, yes, we will call the radiology, but we will arrange appointment as soon as possible. Not give
Mhm.
promise to
Yeah.
the patient.
Yes,
We will do
exactly.
today.
Don't
Yes.
give an promise. Yes, I
Mhm.
agree.
I'm not
Thank you, Dr.
quite sure regarding we will give her a private room. So because we might not find that and it's not an option. So we can say we'll discuss it with the bed manager, the hospital business.
Perfect. Yes.
I think we couldn't say we'll, because we don't, this is not our job and to give her a private room and the side room only for transmittable infection. So I
I
think,
think Dr. Marwa said calm word,
Quiet,
more
quiet
calm
room.
word,
Quiet
more
room.
calm word.
Yes.
okay,
So it might be, Dr. Sarah, as a quiet room with quiet patient. It's not quiet
Yes,
room
I
as yeah, as a single room, or the
there
patient
is
will. You
to
got it?
discuss the bed with
Yeah,
nursing.
it's good to refer
Yes.
this issue to the bed manager, but you can reassure her that we can try our best also to put you in a calm or a quiet room with a quiet patient or a quiet ward.
Mm,
At least address this concern with good way. Okay,
mm, okay.
whatever the way you are convinced with, like calling a bed manager or by yourself, it's not your job. Yes, but you will do it by another way, not in
Yes,
front
I
of
think
her.
only not to say anything we couldn't guarantee because we give her false hope about that. That's why I'm saying to be diplomatic.
Yeah, yeah, I agree. Yes, I agree. So it will not be single room or difficult to be single room for a patient
Mm.
who is irritated because of other patient, because this is not a hotel, this is a hospital, and we don't have single room unless certain situations.
And I think also in this scenario, we should assess the patient how she knew about this infection. And if you don't have the treatment, what will happen. So it could be transmitted to other parts in the body. It could affect any other organs. It could affect the kidney. So by this way, we'll make her feel fear, not to go home or to be aware, because the patient might not be aware if as a consequence of going home. So any patient want to be discharged against medical advice, I think it's better to assess her knowledge. As a patient with infective endocarditis,
Yes, you're right.
go home. Do you know what is the consequence if you will go home without receiving the treatment? What might happen if you are not closely monitoring? So if you will make this to make her frightening or not, or be aware that it's serious if she will go home and not monitoring. So I think this is also will be an important thing in the scenario.
Yeah, I agree for that. Yes, if you give her serious
Yes, to assess also
complication.
her mental by this
Yes,
way we assess her mental capacity of understanding about this urinary tract infection and this is affecting the kidney. That's why we need to do the scan to check about the kidney function and to be aware. And if you won't take the antibiotics through your vein in the hospital, what do you think? What will happen at home? And here we are checking your vitals every 6 hours.
yes,
So, and we check your blood every day. So, what do you think? Why if you will go home and this will not happen to you? And at the end, if she insists to go home, okay, so we'll safety net her and also give her a follow up in the outpatient clinic. That's I think that we do.
yes. Yeah, I agree. The only missing point also from Dr. Marwa regarding the seriousness of the complication of the UTI or pyelonephritis. It might be spread to other organs or to the blood, and it will be serious condition.
Yes,
It might also end up with kidney
right.
failure. Yeah,
Yes.
it might damage the kidney. Yes,
Mm.
in order to convince her by this way. Yes, good idea. Thank you, Dr. Sar.
Okay.
It's not only for this scenario. Any scenario patient will
Yes.
leave
Mm.
against medical advice, you can tell him, what do you know what the sequelae of leaving the hospital in this situation? Anyone told you about this? And it might be also from the beginning. What do you know about your condition so far? So in this situation or in this sentence, she will start to tell you, I have one, two, three. Then you can ask her, so what's your expectation if you leave the hospital with this condition? So in this, the second question, you can tell her the sequelae of leaving the hospital and the seriousness of the condition if not, or if left untreated, it
Yes.
will be serious. Yes.
And I think, Dr. Basim, it is a fatal
Yes, of
in this
course.
scenario. So we have to minus Dr. Marwa in welfare. Will
Okay.
be and really
Yes, yes, you're right.
unsatisfactory. Yes.
No, no, not to the extent of unsatisfactory. She told her you have medication should be given through the blood channel. So I think it's still she convinced her.
He
And
convinced
again,
it,
if
so I not really.
yes,
I
if the
need to
patient
tell more
convinced,
things.
yeah, I think.
Oh.
But also know it, Dr. Marwa, please. Put it
Mhm.
in your mind. Put it in
Yes,
your
okay,
mind.
okay,
Any
no.
patient want to leave against medical advice, tell her or tell him the possibility of having
If she
complication.
insists, I will.
Even before
Yes.
insisting, it's one of
Mm,
the steps, by the way, one of the steps
mm,
to convince a patient want to leave against medical advice, to tell her about the seriousness of the complication.
mm, yes.
Yeah, as Dr. Sarah said, she might be feared from this complication and she might stay. But if you let her, if you didn't explain, she might think this thing will happen lightly. Nothing will happen. I will be okay. I will take drink water enough and I will be fine. No, it's not. It's not only
Mm,
related to the hydration, or this is
mm,
also for the clinical judgment. It's also related to the medication, the antibiotics, which is IV antibiotics. It's not only antibiotics. Okay. I guess it will be the welfare or the clinical judgment, Dr. Mahmoud.
I think welfare, Dr. Welfare.
Uh-huh.
It is, I think it is fatal mistake, Dr. Basim.
but I didn't let her go.
I think the same scenario came to my friend,
Yeah, yeah. Tell us about
and
Mm,
yeah.
yes, he failed to do this issue.
Because of
Didn't mention the if he leave he will leave the hospital, what will happen to his kidney.
oh my
So
God.
I think it is a fatal mistake.
but the patient, yeah,
Yes,
uh,
pyelonephritis, he may lose
the,
his kidney,
the
and
patient
it is irreversible condition.
in
Yes,
your friend case, the patient will leave
the
the
same
hospital
case.
or will
Patient,
stay.
yes, patient has pyelonephritis
Oh,
and asked for discharge. The same case. The same case.
And they give him unsatisfactory.
Yes, unsatisfactory, sure, Dr. Basim. And he
Oh my God.
He fails the communication. Fails the communication.
Why? It's unsatisfactory in one station and in one skill.
Yes, I think the second scenario also fail.
Ah, okay.
Fail in the communication. There's my friend fails only in communication. He success in consultation and clinical. He failed only in communication in
Wallahi.
Egypt. Wallahi,
Yes. I
my
I
friend named Tariq, he was
I
Sudani.
guess I guess as Dr. Hind said yesterday, Egypt become toxic center. Really, wallahi. Oh,
Yes.
yeah,
You
for
know,
this.
here in the UK, all people is a training in training. They get the full mark in communication and clinical consultation. There are students still graduated 3 years
Yeah,
only from
yeah.
university, but
But
I don't
still
know.
they can
And
get the
even
full
they're
mark.
not practicing at all, and get the full mark in both stations. This is we are suffering every day in clinical consultation and communication. And they say, when I'm asking them, did you get full mark in communication? I didn't practice at all. Only in one course I did one station. So they have good communication and good clinical consultation.
But they are fair enough, Dr. Saleh.
The
The
opposite.
examiner very
The
fair.
opposite. The opposite
Here,
here
here,
Yeah.
in Cairo.
we are as international people. We are
You
I don't know what happened to them.
that.
you know, Dr. Basim, because we know the cases, we will enter in the Cairo. So the clinical will be easy, but the communication, we failed in communication and the clinical consultation.
And here also we couldn't. If you find patient in the exam and you know him, you need to declare that you saw this patient before, or if the patient know you. I see that in Egypt they are bringing the same patient. This is illegal.
The same patient, you know, doctor,
Yes, they
there is
are.
the
They
same
are.
patient will be for example in Sunday in Al Maadi, Monday in Qasr Al Aini.
This is
يعني
Mm.
the same
good.
patient,
No, here we
will
couldn't.
be.
No. Here it's not. It's not ethically even. I don't know.
No,
What we
we like that. Thank you, Dr. Sar. Don't worry.
but final the result, what are the final results? If you know the patient or if you are memorizing the scenarios, still they can fail you for another things.
Yes, Dr. Basim, because the examiner knows that we know the patient. we know what has the patient. So if we forget one sign in the patient, he
Yes,
will
exactly.
he will fail us.
Yes.
Because they know that we know the patient from his hair to his leg.
Well, it's not excuse to judge us on this.
Yes,
They
but in
are
UK there
unfair,
are
wallah.
yes, in UK they're fair. The patient come, if you diagnose the patient, okay, it's okay.
Yeah, they are unfair.
Unfair in Egypt, yes.
Okay.
But here,
Anyway,
some unfair also. Some examiner cannot judge well. It's in every place.
Yes, you know, today I meet one friend in the course. He showed me the feedback. One examiner write in the feedback, he not told the patient patient was mitral stenosis in the feedback. That the doctor didn't mention that the patient has mitral stenosis. The other examiner in the feedback told that the doctor told that he has mitral stenosis. So one examiner told that he doesn't have mitral stenosis, and the other the same patient.
discrepancy.
I noticed
Yeah.
when I was revising with you, I noticed in one station, one examiner giving me satisfactory, the other one didn't give me, and Dr. Basim told me you should appeal about that, but I didn't. So I think
Yeah, you should.
Useless, really useless.
Yes, I know. It should be recorded, in the PLAB it's
Yes.
recorded, so it's fair.
Yes, and the USMIL also recorded,
Yes.
and another doctor will be evaluate you. Yes.
Without face to face or only.
No, they record while you are examining the examiner with you face to face, but there is recording. They are recording
Yes.
Okay.
in the room.
This is recording, and if we need feedback, another doctor, another examiner
We'll
will
listen
come. Yes, will.
Yeah.
and we'll give you the mark or not.
Okay.
Recording in
I
MRCP.
got it now. Unfortunately.
Yes.
Okay, thank you, Dr. Sarah. We corrected the mark, Dr. Marwa, sorry, but we have to learn. You have to learn that this is very fatal and it might harm your mark. So what to do? What to do is alarming the patient about the seriousness of the condition whenever the patient want to leave. This is the take-home message from this scenario.
Yes, Dr. Basim, in Arabic, one friend told me if the يعني المريض ما جاش بالحسنى يجي بالسيئة بقى نقول له الكومبليكيشن.
Yeah, but
So
not
remember
in
that.
confronting way. It's not confronting way.
Yes,
طب if he convinced if he convinced
okay, as he like, but we told him that you may be lose your kidney. Yes.
You need by
Dr. Marwa, just a minute. In the comment on this scenario, you need to tell the patient about the hair condition and the hair complication. Your condition is named like this, and the any disease, you need to talk about symptoms and the complication, the symptoms that the patient come with, and the complication, the sequelae, if not treated. You need to do this, okay? And everything you have to say about the risk and benefit. What if you get it, if you do it, what is the benefit, and if you don't do it, what is the risk, in all things that you ask the patient to do.
Yes, all procedure. Yes, any
All procedure,
either
medication.
Yes.
Yes. Even staying at hospital, this is the benefit and this is the risk if you left, and
Yes,
let him decide.
fatal mistake. Yes, sure.
Yes. And also this is to assess, because this patient might not be aware about her medical condition. So she said, okay, I'm happy to stay, but she's not aware. So you will assess the awareness of the disease and the complication and the risk by asking her. This is this is the main thing in this scenario, because you might have. I see one scenario is infective endocarditis. She want to go home. I'm feeling well. I can take the antibiotic come every day. But you know that the infective endocarditis can cause a heart attack, can cause that. We need to monitor closely. So she's not aware about the sequelae. She's not aware what is infective endocarditis itself. So you need the beginning to assess.
Yes,
Know
this is
how
from the
much you
beginning.
know about your condition. Do you know what
Yes.
what's happened if you won't take the treatment, if you're not monitoring closely? So this is important. Even the patient is convinced, she might be say, okay, I will stay, but they give you bad marks because you didn't say that. Even the patient, the surrogate can make himself that he's convinced and happy from you, but this is not the truth, because they have some point to assess. This is for the patient welfare. She need to be aware about her condition, and not threatening her, but try to make it, how much do you know what will happen if you are not doing that, and tell her what we are doing in the hospital. We are checking your vital every 6 hours. We'll check for you daily blood to check your inflammatory markers. So we are closing you, we are monitoring you closely, keep an eye on you. So what do you think? Keep it her in her. What do you think if you go home and something happened? So try to convince her, because this is the main issue in this scenario. Because you will face a lot of scenario like this, and this is the main thing. At the end, if she said, I will go home, so and by this way you have already assessed her mental capacity. If she said no, I will go home, so she's aware and she has the full mental capacity to take the decision and to self discharge herself. Okay. So the main thing, and this is the way, try to convince her, and also by this way you assess her mental capacity, because it's assess if she's confused or not, but you will assess her mental capacity by asking her about the condition, because she might not know about anything and she take it lightly and she want to go home. So anything like this, try to do all the things, and on everything that she will say it, don't say, I will give you a quiet room, I will do for you the scan now. No, I will call the radiology, they might be busy, so I will try as much as I can. I will check. It's because you are not taking the decision, as Dr. Bassem said, she might blame you after that. So this is the three things from this scenario, and you'll face a lot of scenario like this.
Yes, there is similar scenario, Dr. Do it now. I will give it to you because you gave me a scenario last day
See?
about. Yes, I will give you a scenario because you gave me a scenario last communication day.
This
It-
is sudden.
no, it's a simple scenario. It's about paracetamol. Patient take paracetamol and the levels were okay, and she want to go home and she feel herself okay. If you agree, we can do it, or if you want another day, no problem.
Okay.
But the idea of the scenario is the same. Patients for she want to be self-discharged.
Okay.
So I can write for you. You can start it.
Okay.
Okay, so I will write.
Yes, but before Dr. Basim, in clinical
Uh-huh.
judgment, I think also unsatisfactory.
Why?
Yes, judgment or borderline.
For what you mean? She
Clinical
addressed the
judgment,
concerns.
no judgment.
What point? Yeah, I mean she already addressed the IV medication, antibiotics. This is the clinical issue in the scenario. The IV antibiotics. What other things you want to be? You got my
Okay.
point?
Yes, Dr. Basim. Okay.
She said you will stay to take the medication by blood channel, and this is the best interest for you. Always try to say this, Dr. Marwa. Best interest for you to stay, best interest for you to take this medication in the blood channel. And as Dr. Sarah said, we will do the follow up, the monitoring. Okay. Any else? Anyone else want to comment? This scenario, it was taking paracetamol
Hmm?
instead of antibiotics. She was having teeth ache
Hmm?
or toothache and prescribed for her amoxicillin, but she took the paracetamol instead of amoxicillin. Okay.
So she took high dose of paracetamol, right?
Yes, toothache.
Okay.
Then she had I'm writing the scenario. She had abdominal pain. Okay, you have Mrs. Julia Alfred, uh, 35 years,
Mhm.
admitted with paracetamol overdose by mistake instead of antibiotics for toothache. Then she had abdominal pain and admitted as paracetamol overdose. Patient feels fine and well and wants to go home. Sit with her, address her concern.
Okay, but it's not written that the paracetamol level are normal, or it's written.
Okay, I will write. So yes, the paracetamol level was okay. Wait.
Okay, I can start it.
Paracetamol level was or were within normal ranges. Okay, it's clear now.
Okay, I can start.
Yes, resets. Yeah, here you go.
Hello,
Yes, hello.
am I talking to Mrs. Julia Alfred?
Yes, I am doctor.
Are you 35 years old, right?
I am doctor. Yes.
My name is Dr. Mahmoud. I'm one of the doctors here in the hospital. How are you doing today?
Doctor, I feel fine and well. Thank you for what you offer me. The care, everything here was okay. But please, I am fine now, doctor. Let me go home.
I'm really happy that you are feeling well, Julia, and and this is our job to help you with that. But I just want to ask you, you said that you are feeling well. You don't have any tummy pain now?
No, doctor, I'm fine.
Okay. Okay, and can I ask you, is any specific reason that you want to go home?
Yeah, doctor, I have social issue.
Hmm?
I must go.
Can I know what social issues that you have? Because we might help you with that
Yes, doctor, it's my sister wedding day.
today, right?
Yes,
Okay.
and I feel fine, doctor.
Yes, I really appreciate that, but I just want to, at the end, I just want to tell you at the end, it's your decision. If you want to go home, you can go home. But let me first ask you, how much do you know about your condition and what happened, why you are admitting you here in the hospital? You know,
Yeah, doctor.
same thing.
I was admitted for because I took the medication for painkiller, but it was by mistake, doctor. I swear, doctor, it wasn't suicide. Some doctors told me that I had think about suicidal attempt, but no, it wasn't. I just took the medication instead of the antibiotics for my toothache,
Mhm.
and the dentist gave me this both medication, but by mistake I took the paracetamol.
Okay. And have you ever, is anyone sit with you, told you about what happened about this high dose of paracetamol taken and how it will affect your body?
Yeah, doctor, they told me it might harm my liver, but what I heard also that the level of this medication was promising, and nothing happened right now, doctor. I don't have any tummy pain.
I'm really happy for that, but I just want to clarify for you regarding when having this paracetamol, which is, as you said, it's when it's the level is become more high in the blood, it can affect your liver. So that's why we are keeping in the hospital for observation, and we are doing for you on daily blood test to check your liver function. So
Uh-huh.
that's why, because if your liver function is not good enough, so you need to give you some medication through your vein. That's why we want to make sure that all your condition is stabilized. Because if you are not treating this condition and take it seriously, it might affect your liver and your liver might fail. How does that sound?
Yeah, doctor, but I feel myself well, doctor. And let me go home, doctor, please. I feel myself okay.
I really appreciate that you are feeling well, but some people can feel well, but their liver function is high. So it and then all of a sudden it will they have liver failure. That's why it's not meaning that you are feeling well, that your blood test still in the normal range. We need to make sure that your blood test in the normal range. How does that sound?
So, doctor, when I can leave this hospital exactly?
So what we will do for you, we are closing, monitoring you, we are checking your vitals every 6 hours, and we are doing for you, we are checking your liver function on daily basis. So we will repeat for you the test, and if its level become normalized, so we and you don't have any symptoms as tummy pain, so we are happy to let you go home. How does that sound?
No, doctor, I feel okay.
Mm.
Please, doctor, I want to leave, doctor. I can't stay more.
Okay, so I just want to ask you: is the wedding of your sister today, or when it will be?
Yeah, it's tonight, doctor, and it has been now 4 p.m. and I feel myself okay, and I should go early to prepare myself.
I really appreciate all of that, and congratulations for your sister. Uh,
Mm-hmm.
but I think, as I told you, at the end you will take the decision. But I think your life is is our priority, and also your life is important to you and to your sister. So, as I told you, if you will go home, we your condition might deteriorate, and we might not able to monitor you. How does that sound?
Okay, thank you, doctor, for your care.
Hmm?
Uh, I will be taking care of that.
Okay.
But still, doctor, please, I should go.
So let's take it by step. I will ask the consultant to have a discussion with you. He might explain for you he might be in better position to explain for you in a better way. And at the end, if you insist to go to home, you have the full mental capacity and you are of a sound mind, so
Uh-huh.
you can go home. And tomorrow I will prepare for you to come in the morning. Are you able to do that?
I will try, doctor, my best.
Okay, so I will to repeat for you the blood your blood test, and also I just want to tell you at any time you feel you have tummy pain, you have vomiting, you feel you have vomiting, or you have any change in your color of your skin, or you notice your urine is dark, please call 911 or call the ambulance to come to take you. How does that sound?
Thank you, doctor, again for your care.
Yeah.
And yeah, so I can leave now.
So I will ask the consultant to come to see you and we'll check your blood test. And then if you are still insisting to go home,
Yeah, doctor, please.
so you can go, and tomorrow I will arrange for you a follow-up in outpatient clinic.
Okay, doctor, just please arrange for me this and I can leave.
Okay, and just want to ask you some question.
Mm-hmm.
How is
Sure.
how is your mood, Leah?
I'm fine, doctor. I'm okay now because this is my sister day. I should be happy for her.
Yes. Yes. And how about your tooth pain? It's
Yeah, it's
control.
subside, doctor. I don't feel any pain now.
Okay, and you know now the antibiotics that you will take. Did anyone explain for you the dose and how you will take it?
Yeah, yes, doctor.
Okay. Okay. So let me ask the consultant to come have a talk with you,
Uh-huh.
and I will arrange for you the follow-up.
Okay, doctor.
Do you have any other question for me, Julia?
Um, Doctor, when I will visit you again, you told me.
I want you to come tomorrow morning because we need to close monitoring your liver function.
Okay.
I told you it's not an easy thing to have this paracetamol level in your blood, and it might affect your liver, and it didn't appear now. That's why we need to check your blood, closely check your blood. That's why we will do it for you. Okay.
Okay, 2 minutes left.
Okay, and just want to ask you, Julia, do you
Mhm.
drink alcohol?
Sorry?
Do you drink alcohol?
Yes, doctor, I am.
How many units
Maybe around 14,
per week?
yes, in a week.
So I just want to ask you to try to decrease, and I know that you have a wedding today, so try to decrease your intake of alcohol, because this also affects your liver, and we don't want to put many factors that can affect your liver. How does that sound?
So I can drink, but less amount.
It's better not to drink, because we still don't know how is your liver function will go. We don't want
Yeah,
to
what?
take more.
So what do you think, doctor? I can drink even little amount, or
I think if you are able not to drink at all, it's better, because we don't want to put more burden on your liver. How does that sound?
yeah, doctor, sound good for me.
Okay, and what about smoking? Do you smoke?
Mm, I'm not smoker, doctor.
Okay, so that's good. Okay, and I just want to ask you: is anyone with you at home today? Anyone taking care of you at home?
Yes, I live with my boyfriend.
Okay, so I just want also, you will tell him, or you want me to talk to him to tell him about any red flags that he might see with you, or you might feel, so he can
Okay.
and close monitoring.
Okay. Yeah, doctor. Okay, I can invite him, or you can
Okay.
have a call with him. Yes.
Okay, after your permission, I can call him and explain
Yes.
how to close monitoring you, or for any red flag, he can call the ambulance or to come.
Okay, doctor.
Okay. Thank you, Julie. Okay, thank you.
10 seconds.
Finish.
8, 7,
Finish.
6,
Finish.
5. Again, offer. Why not?
Okay. I finished.
You can offer leaflet, or even for the red flag, paracetamol,
Yes,
toxicity.
some leaflet for
Yeah.
the
Okay.
first. Okay.
Okay. Well done, doctor. So yes, this is the way how to do. I guess you did everything in this scenario.
Yes, but
Start.
there is
Yeah.
also mistake, Dr.
Yes, there
Bassem.
is miss. Yes.
Yes,
He
it is a
didn't
fatal
fatal.
consent for
Yes,
Dama.
the refusal. Dama. Yes.
Refusal
Dama.
Dama. Yes, it
Dama,
is a
Doctor
fatal
Sarah. You
mistake.
always said
What is demo? What is demo? Sorry.
Dama paper, the
Discharge,
discharge against
consent.
medical advice. Yes, you're
Yes,
right, Dr. Mahmoud. I kept
it's fatal.
in my mind. Yeah.
So no, the nurse will do that. She will be discharged.
No. You have to
No,
tell her. You have to tell her. Yes.
this will fair.
Okay.
Yes.
So I need to tell her you need to sign
Yes. You
discharge.
have to sign a paper form
Yeah,
called
discharge.
Dama. Yes. They
Yes, it is
discharge.
a legal issue. Yes.
Yes, exactly.
Okay. Sure.
If this patient went home and anything happened, you don't have any document that she signed this paper, or
Yeah.
she left
So
against this
okay.
advice.
Okay.
Yeah.
So I will let you sign a paper that you want to
Yes, exactly.
this medical advice. Okay.
This
And I
one,
think
this paper
I
will
need to
be
put
offered.
more. The nurse is giving us here the paper to sign it, so that's why I didn't say it.
Yes,
But
they
all
are.
right.
Yeah, they are. But you are the one explaining it.
Yes, and the other things I think I need to talk more about the hepatic encephalopathy and all these things. I didn't say about even the hepatic encephalopathy, feel drowsy. I think I should.
Yes, Dr.
But the
Bassem,
level,
Dr. Sarah يعني tells that only red flags. What is the red flags?
the red color and
Yes,
the
she
urine.
didn't tell her here when come to the hospital. I
No,
think
I
is
told
that.
her about tummy pain, vomiting,
Yes, feeling sick,
sneezing,
throwing up.
but I think I should say about the confusion, the hepatic encephalopathy.
But the good thing here also, you alarm or you give her red flags to the boyfriend who's living with her. If he feel his girlfriend is not okay, I think this is okay for that. But the DAMA paper is, or DAMA form is fatal, right? Yes, I agree. In the
Fatal,
same,
yes, it is
yes,
legal issue here.
yeah, it will be against the welfare. Yes.
Welfare.
Okay, how did how did
No, we are learning from this
No,
mistake.
no, no.
right fatal. ما خلاص
Yes, it's.
موتنا لسه ما فيش فيتل اكتر من كده يعني فخلاص بقيت من زمان يعني انا ريبيتر اصلا.
No. It's not. We are learning always from these mistakes.
Yes, you are right. Yes, this is
By
important.
the way, sometimes you do the scenario here in the meeting, I mean, and you face the same scenario in the exam, and it will be your first and last, and you will get the full mark.
Yes, you are right. Yes.
But in the exam, you will avoid this mistake. You will correct it. Why? Because you learn it. You got it?
Yes. Shiny people. Yes, you are right.
Yeah. Thank you, Dr. Mahmoud, also for reminding me. Well, I put it in my mind that she should do the dama. When you tell the patient, you will sit with the examiner, sorry, with the consultant, and I will provide you a form called DAMA form. It's in abbreviation, Discharge Against Medical Advice. What is that, doctor? This form means that you are going home on your responsibility or upon your responsibility.
Yeah, the short
Uh,
against medical advice. We
Yes,
will
it
like.
is.
yeah,
It is one skill. Yes.
yeah.
Mhm.
Yes.
Okay.
So you have to know it. You have to offer it whenever, as in this scenario exactly. I did this scenario, and for aiming for learn how to manage insisting patient to leave. So you can tell her this is the form at the end, of course, after consultant meeting. But she is insisting. The consultant meeting, like nothing will happen after. So again, she will leave. The consultant will try, but still she's insisting. And the good thing also, we give her another appointment for tomorrow. Please come back to us. We will do a level as soon as possible. And the red flag is very important. You did it. But the only missing point here, the DAMA or the consent
Yes,
form
you know, Dr.
or
Bassem,
refusal form. Yes.
one patient, it is in a real practice. When I told him that,
Mhm.
okay, sign consent for DAMA, patient refused. Tell me, no, I will
Yeah.
stay in
Okay.
hospital.
Then stay in the
Really?
hospital. Oh, yes.
Yes.
Legal issue, legal wise, he will be blamed if anything happen. And you will be protected in the opposite side.
Yes, and the only
Okay,
important thing in exam, Dr. Sarah, you will fail if you don't tell the consent. Really, sure.
Okay.
Okay.
okay. Thank you, Dr. Mahmoud. By the way, you can fail the station, but you can't pass the other stations. I mean, in this scenario, what will be minus here? The welfare. Okay, you will get to 0 out of 4 in the welfare. So
Yes.
the mark will be 12 out of 16, for example. But the welfare in general scale, it might be affected by another station, and in general you can fail in this skill particularly, which is the welfare, if you fail it in another station. But you might pass the exam if you fail only this
Yes,
station.
welfare, Dr. Bassem, in the exam 12 only. If you lose 4 from 12 from one station,
No, it's not
uh,
12, it's 32. 32.
in welfare,
32, and the pass, yeah, the pass mark in the welfare
yes,
is 28.
yes, the concern who is the 8
28.
only. Yes.
28. So if you fail it in two
Mm.
stations, you might you might pass because 28 minus 32, I think 8, right? So if you fail in another station, the welfare, and in the three station, if you fail, you will fail the exam. But if you have unsatisfactory in two stations only, you can pass on the borderline mark 28. If you got borderline in third station, you will fail because the pass mark in the welfare 28 out of 32. I will send you the pass mark in the WhatsApp group to be aware more about the pass mark. Okay.
Thank you.
Okay. Thank you, Dr. Sarah. Thank you, Dr. Mahmoud. And Dr. Marwa also, I think she left. Any comment from others? Sorry for being late today, but we try to compensate. The last session, she gave me a scenario and I gave her also. And in the same session, we tried to make
Patient,
similar scenarios. Yes.
sir, patient,
Hello?
sir, patient, while she
Yeah.
was convincing the patient answered that his blood paracetamol levels are normal, and he
Yeah.
raised a question that for how much days he should be staying. No, sir.
If she stayed, you mean?
Sir?
If she stayed and she is convinced to stay,
Yes,
and
sir,
she
yes,
ask
sir.
you, she ask you how many. So what do you think, doctor? What do you think? How many? hours you can tell.
Yeah, we can't be
Exactly.
100% sure, sir. Yes, sir.
Yes, exactly. So you will not give again sharp cut off for staying. We can
Yes,
say
sir.
like days or hours, but don't say hours because it might be raised again the paracetamol level, and it might have also kidney failure. You know the paracetamol not only
Yes,
affecting
sir.
the liver, it might harm also the kidney. That's why we are doing renal and liver function test. So it's few days. You can say few days, and we will
Yes,
assist you
yes, sir.
day by day, as Dr. Sarah said, day by day, in daily basis, doing the labs and the
Yes,
paracetamol
sir.
level in the blood to be sure that
Yes, sir.
everything is okay. If everything
Yes,
is
sir.
okay, we will give you another appointment to update you about the discharge plan.
Yes, sir.
Okay, clear?
Yes, sir. Sir, and I have a doubt in the previous scenario, sir. So
Yeah,
the previous scenario regarding the antibiotics, the patient insisted on going back to the home.
yeah.
So is it an option of giving the IV antibiotic in the home, sir? Can we explain that? Can a home nurse come and give the IV antibiotic in the home?
It's not only IV antibiotics, right? It's
Yes, sir.
as well
Or
as IV fluid, and good hydration in pyelonephritis is much better and much important than the other things. So
yes,
it's
sir.
important to convince to stay at home. No, sorry, at hospital. No option to
Yes, sir.
take the medication at home because the IV medication and the IV fluid.
Yes,
So
sir.
if he offered you, I can take the medication at home. No, it's difficult. Not in this scenario. There is another scenario for infective endocarditis.
Yes, sir.
Uh, yeah, and they are giving it on time. The patient due time, patient will go to the hospital to receive the medication. But why? Because it's only antibiotics. But in this scenario, patient is
Yes, sir.
taking IV fluid in addition to the antibiotics. So it's difficult to
Yes,
have
sir.
IV fluid at home, right? It's not
Yes, sir.
only medication.
Yes, sir.
I,
Sir, my doubt is even after we are insisting the patient is going anyway, sir. So can we do at least this least good, which is possible? Can we give arrange this? So that is also not possible, sir.
the what the dama?
Anyway, the patient is gonna sign the LMA, LAMA and going to go home, sir.
Yeah,
So
yeah, yeah.
I'm asking, so it's the least good thing we can do, sir.
Yes, you can give him this. You can offer whatever the patient situation and he want to go and insisting after consultant with a meeting with the consultant and everything, you have to
Yes,
offer
sir.
him this.
Last
And
option
in
we can, yes, sir. We can offer them that they can get an antibiotic in the home, but the home nurse, sir. Yes, sir.
if he left, yes, in the dama and the patient already, yes, he can come on time to take the medication, and we will. You
Yes, sir.
can and you have to give him red flags. What will
Yes,
happen
sir.
if you didn't stay? And
Yes, sir.
what might happen, you have to come again in any time. But yes, he can take the medication if he insisted at the end. He should take the
Yes, sir.
medication IV on time. He can come to the hospital in the emergency to receive the medication on time.
Yes,
But
sir.
upon her or his responsibility, as you said. Okay.
Yes, sir. So IV antibiotic only in the emergency, sir, not in the home, sir.
Yeah, yeah. And
Okay.
in the hospital in the emergency.
Yes, sir. Yes, sir. So regarding infective endocarditis, you can we give it in the home, sir?
I heard there is possibility to give this medication at home by a home care nurse.
Yes, sir.
Yeah, but it's better to come to the hospital in due time. But if he said it's impossible for me, I can't come back, and you can offer this.
Yes, sir. So first I will advise him to come and get the
Yeah,
antibiotic
to come on time. Yes, to come on due
every,
time. If
every
not,
day.
The
And,
service, there's a service called OPAT service. It's outpatient parental antibiotic service.
yes,
So the OPAT is outpatient, so the patient can come every day to the OPAT clinic, which is
yes,
outpatient
yes, sir.
service to take antibiotic. Some patients also they can have they put for them a cannula and they teach them to do it at home. If this
Yes,
patient
sir.
is not an intravenous drug user or high risk
mm-hmm.
to take for
Yes, sir.
himself
So
recreational.
better in infective endocarditis, better to be in the hospital in this
Yes,
way.
say we can arrange for you in the outpatient OPAT clinic and
Uh-huh.
have the antibiotic in through your veins on daily basis.
Uh-huh.
Yes, ma'am. So daily the patient has to come to the outpatient clinic and get the antibiotic at correct time. That's the thing we can
Yes.
do. Yes,
Yes,
yes, sir. Yes, sir. Yes, ma'am.
Yeah. OPAT, Dr. Sarah, OPAT, outpatient.
yes, I will send it on the group. Yes.
Yeah, better. Yes. Okay. Thank you, Dr. Sarah.
Thank you, thank you, thank you so much, sir.
Thank you. Thank you. Any other questions? Thank you, Doctor. Thank you, Dr. Dr. Mahmoud, all of you. If no questions, we can end the session.
Thank
Okay, thank you, Dr. Sarah. We'll see you tomorrow, inshallah, with Clinical Day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.